Jean White's mother has dementia and moved into a memory care facility near Tampa, Florida, just as coronavirus lockdowns began in the spring of 2020. For months, the family wasn't allowed to go inside to visit. They tried video chats and visits from outside her bedroom window, but White said that just upset her mom, who is 87. White's mother couldn't grasp why she could hear familiar voices but not be with her loved ones in person. When the family was allowed in to see her, disruptions continued. White said the facility kept shutting down anytime a resident or staff member had the virus. All the while, her mom's memory was deteriorating. You know it's going to happen, but still, when it does. And when you haven't, when you miss time that you thought you had, White said, speaking haltingly and with emotion as she talked about her mother's decline. Restrictions on visitation have relaxed in recent months, White said, but she questions whether protecting her mom from COVID-19 was worth the lengthy separation. What anxiety, loneliness and confusion she must have had. I think I would have rather her seen her family, she said. On March 11, the Florida Legislature passed a bill that will make it easier for people like White to see their loved ones in health facilities. Governor DeSantis is expected to sign it in the coming weeks. At least 8 states have already passed similar laws, and several others have bills under consideration. Some laws, like those passed last year in New York and Texas, are specific to long-term care facilities. They allow residents to designate essential caregivers, also known as compassionate caregivers, who are allowed to visit regardless of whether there is a health crisis. Texans also added protections in their constitution. Other states including Arkansas, North Carolina and Oklahoma passed similar no patient left alone acts that also guarantee visitor access to patients in hospitals. Hospitals and long-term care facilities set pandemic restrictions on visitors to protect patients and staffers from infection. But supporters of these new laws say they want to ease the restrictions because the rules may have harmed patients. An Associated Press investigation found that for every 2 residents in long-term care who died from COVID-19, another resident died prematurely of other causes. The report, published in late 2020, attributed some of those deaths to neglect. Other deaths, listed on death certificates as failure to thrive, were tied to despair.